Lately, life has shown us that emergencies can happen at any point in life. Sometimes someone might feel normal, and the other time there could be emergencies like, slumming, there could be breathing issues, struggling. But before professional help arrives, the first few actions we take within that second can make all the difference. And at this point, you're already thinking, what am I talking about? But before you get to know all of that, good evening and welcome to Gyna Plus, where we discuss health issues that affect women and girls in the society. And today, we're doing something, I want to call it a bit of a special. Yeah, unlike women, just women and girls, this information is for everybody. Family members, for your loved ones, and for you as well. So we're going to talk about first aid, why it's important, at what point should you, swing into action should you find your loved one in a situation that looks like, hey, you need to help. Now, my name is Doris Mayim Shisha, and this program comes up every Wednesday at 6 p.m. and there's always a repeat broadcast on Saturday at 8 p.m. And after this break, you're going to meet my guest and we will delve into action, where you'll learn all about first aid treatment and of course when and when not to move into action. To stay tuned, we'll be back after the break. Welcome back. If you just joined us, you're still watching Gyna Plus right on Afia TV. And today we are talking about something that is quite common. I mean the word. We get to hear the word first aid almost every time. But do you know what that basically means? At what point you should swing into action to help your loved one or people around you? Well, my name is Doris Mayim Shisha, and we're going to talk about first aid treatment and why it's important on the show today. And remember, I said it's a kind of a special. As much as it will benefit men and women and children, men too would also benefit from these particular episodes. So please, my guest today on the show is Dr. Chinemelum Igbonekwu. Of course, she is a Senior Registrar, Department of Anesthesia, University of Nigeria Teaching Hospital. Someone who is here on this set for the very first time. And I'm so pleased to have you, Doctor. Welcome.
Thank you.
And thank you for joining me. You look adorable.
Thank you.
I love the brain, the hair, and all of that. Yes, welcome. And on this set, we talk about everything health, and of course, you're here because you're a professional. And I'd like you to give us the basics. When we talk about first aid, what is it really, and why is it important?
Okay, so thank you very much for having me on your show. So when you talk about first aid, it's basically the immediate treatment you give to an individual who is injured or sick. So first aid can happen anywhere, on the street, at home, you understand. So the individual administering the first aid has to know what to do at that point, so that the person who has the injury doesn't become more injured or doesn't get sicker before you're taking the person to the hospital. So first aid is basically the immediate treatment you give to an individual who is injured or sick before taking the person to the hospital for definitive.
Yeah, thank you for giving us the background to that meaning. I know that it's very important to talk about this, and in recent times, just like I said in my introduction, we've seen lots of emergencies, from fire outbreaks to people getting involved in accidents. And sometimes, while it's so many of us are used to wanting to, take pictures, sending on the internet to say, if you see your loved one, help. What is that first thing that ought to have been done? And in the case of helping, this is like a 2-in-1 question. Are there mistakes that we make in the name of, away from that, even our home settings, in the family settings, you see sometimes a child that gets choked up with a bead, something, sometimes they're getting hot oil on their body or hot water. First step to take in that regard, and then what are these mistakes that one should avoid, basically? More like a 2 question.
Okay, so the first part is what should be done. So first part, if someone is injured, make sure the person is safe. Like, for instance, now hot oils, hot water, all those things. So take it out. Okay. You understand? So make sure the person is safe. The person you want to help is safe. They understand. Then, of course, you should know the right thing to do. That is actually the first aid, and that actually means that you're helping. Okay. Because when you now, for instance, what would I say? Okay, for hot oil spills, you now say, okay, bring egg, bring something.
Okay, so that is wrong.
There's not the bonds at that initial time is sterile. Do you understand? So what you don't want to do is to contaminate the wound at that point, that first point. So anything to keep the wound clean. So first of all, run cool water over it. Good. Then if it's so large, you can cover with a clean cloth, a clean non-fluffy cloth.
Okay.
Then you can go to
That's for a burn.
That's for a burn. So for choking.
So sorry, let me take you back a little bit. So if there's an actual burn from oil spill or maybe hot water, so the first thing to do is not to apply egg, raw egg, honey, all of that.
Cool it to limit the burn process.
Okay, you cool it with anything that's cool water, basically.
Water.
Okay.
Cool, clean water. That's the thing. Cool tap water. It should be clean.
Okay.
Do you understand? It's not. Of course, it's not cool. Cool anything. So you're not gonna get
cool
a drink. So it's cool, clean water. Run it. You limit the burn process. Then, depending on how large it is, you cover. So for a child who is choking, you don't go putting your hand, like, of course, you know this child is choking. You go and put your hand inside the mouth. Say, okay, let me try to remove. You don't do that, because in doing that, you might think that you're helping, but you can actually push the object further down. Except you are seeing it. Then you can remove, put your hand and remove. But if you're not seeing it, don't just go poking blindly, trying to say that you're trying to help me.
Okay, so what's the right thing to do for that scenario of a child, choking from me? Most times they stuff in bead into their throat, sometimes to their nose, and then they start coughing. What is the ideal thing to do?
So the ideal thing is, if the child is already coughing, so you can encourage the child to keep coughing.
Okay.
To clear the airway.
Okay.
Good. Now, unless the child now becomes unresponsive, of course, that's when you now start doing CPR.
Okay, so we'll definitely get to CPR. That is, in fact, we have something special for CPR coming up. But I'd like us to highlight more on the mistakes, because the reason why this mistake thing is coming up, I know people sometimes use substances that there's honey that comes into the picture. You hear salt, apply salt on the surface. You hear put on Vaseline, some lubricants. And medically, do all of these things have any effect in terms of what is the efficacy, so to speak?
Okay, so some of those things that you have mentioned actually being used, like you say honey. You use honey for treating wounds, but they are, how do I put it? They are already prepared in such a way that it is now good for use. Like, it's not, if you say honey now, the one that you use to eat bread, it might be contaminated.
Okay.
Opening, closing, dip your knife inside, spray on the bread and all that. So, but the ones we use for treatment are actually already treated. Like you have honey-soaked gauzes that you can use to wrap the wound. Do you understand? So those things can be used. But for the person at home, there's no need. Just keep the surface clean, to the hospital. Keep it cool, and then go to the hospital. And cover if it's large.
Okay. More practical scenarios now before we move into CPR. We saw the Lagos fire incident. I mean, that was like one of the most pronounced one we have, most recent one, so to speak. And we saw how people were, choking from smoke. We saw the smoke inhalation was intense and all of that. Half the time, some persons were being brought down and they already passed out. So, at that point in time, what kind of first aid should have come in handy?
Okay, so for those people now, of course, you're not going to save the person. You're not going to save the person that is in the burning, in the fire, for instance. You have to move away. So whatever you're doing, the first aider, you need to be sure that you, as the first aider, is safe, and then the person you're trying to administer the first aid to is also safe, and the environment is also safe. You understand? So you have to bring the person out of the fire to a safe place, no oncoming cars. Do you understand? So you lie the patient flat on the surface, and then check, sorry, I'm using patient, is this person breathing or not? Does this person have a pulse or not? So there are different scenarios on what to do. So if this person now, for instance, is breathing and there's a pulse, you just monitor the person, keep the person on a flat surface, and then, okay, you use the fire incident, so of course you transport to the hospital. You understand, for that checks. Now, if the person is not breathing, I'm not going into CPR.
Oh, you will definitely go into. I like the fact that we can't escape CPR for sure. Well, I mean, if you're watching, CPR will come up. If that's what you've been waiting for, just hang on. All right, you can continue though.
Okay, so if the person is not breathing but has a pulse, of course you help the person to breathe. You give breaths.
Okay, that's where CPR comes in.
So if the person is not now breathing and doesn't have a pulse.
Okay, so before we get into CPR, we'll go on a break. But before that break, how do you even check for the pulse? Because I know you've been saying you check if you see breathing. So do I have to literally look at the person to see if they're
definitely you have to look at
just
the
like I'll just have to look at you
flat on the floor.
Okay.
And then you have to come down.
Okay.
And check for chest movements. Rise and fall. That's what tells you that the person is breathing.
Okay. So but that times
most people have quiet breathing, but you can hear the sound of the respiration, but chest movements.
But there are times I see people go to the wrist. Does that tell anything really? Like I see people touching the wrist.
They are touching, they are checking for the pulse.
Okay.
But then you go for the central pulses.
Which is where?
The carotid.
Towards the neck area?
Yes.
Okay. So you have to touch like this?
No. This is the trachea.
Okay.
So you feel for the trachea. That's the easiest way to do it. So you feel for the trachea. Of course, when you touch this central part of the neck, you feel the rings. So that tells you.
So if it's moving,
you go to the side between the trachea and this muscle. There's a groove. Put your hand, you feel it. Because you can actually do it on yourself.
Okay. So here and then.
So you can start from here. You can do it while I'm doing it, because I can feel mine. You can feel this ring. So this is the trachea.
Yes, this is.
Now you move. No, don't move too far. You're moving fast. Just slide your hand. Slightly. There's a groove.
Oh yes, I think.
Now between that groove is between your trachea and then there's a muscle on the other side. So in between you can feel.
Yes. All right. If you just joined us, I mean, it's getting really interesting. This is Gyna Plus, where we discuss health issues that affect women and girls and children. But today is a special edition of the show. We're discussing first aid treatments and why it comes in handy, why you should know about it and what you should know about it. And of course, Dr. Chinemelum has been doing such a great job. We'll take a break, and once we are back, she will tell us more about CPR, how to revive someone, the thing you need to do, and of course, how it's being done. So it's going to be a practical session. So stick around. We'll be back after this break. Welcome back. You're still watching Gyna Plus, and today is something really unique. Unique in the sense that it's an information that will benefit you, every single person, men, women, children alike. And of course, my name is Doris Mayim Shishe, and today we're talking about first aid treatment and why it matters so much. And my guest is still in the studio talking about Dr. Chinemelum Igbonekwu. She is a senior registrar, Department of Anesthesia, UNTH, Enugu. And Doc, we've talked about quite a number of things. You talk about what first aid treatment is and why it's very important. And in between that discussion, you kept mentioning CPR. So I'd like us to go into CPR now properly. What is CPR? What does it stand for? What is it basically?
Okay, so CPR, the full meaning is an acronym. So the full meaning is cardiopulmonary resuscitation.
Okay.
So C for the cardio, P for the pulmonary, R for the resuscitation. So it's cardiopulmonary resuscitation. So it basically entails chest compressions and breaths, giving breath. So it's usually given to an individual who is unresponsive after an incident.
Okay, so let's say someone gets involved in an accident and you one happens to be around that vicinity, and while before the ambulance arrives or any professional help comes in handy, you're meant to administer CPR if you are conversant with what that means. I know this is something that you're going to show us practically, but in a situation where someone slumps, let's say in a family setting, and someone just passed out the slump, is this CPR that is meant to come in as well as a form of first aid in that instance?
Definitely, yes.
Okay.
Because if a person slumps, so like I said, someone just slumps now. You help the person to lay flat on the floor. You check, is this person, sorry, I can mention is this person, I'll have to do that. So is this person breathing? Is there a pulse? So there are different things you do for different scenarios. So if this person is breathing, and like, for instance, fainting now, this person is still breathing, and this person has a pulse, you just monitor the person. And sorry, I want to mention that as you're laying the person down, you're making sure that the place where the person is safe. So, for instance, now this is a home, so definitely everywhere is safe. Good. So you've checked. There's a pulse and there's breath movement. Allow the patient, allow the person, monitor the person, still call for help. You understand? So another scenario, the person is not breathing, but you've checked and the person has a pulse. So what you do, you give rescue breaths.
You give what?
Rescue breaths.
Okay.
So this entails basically breathing
mouth to
mouth
mouth
respiration. Of course, you should have a barrier, except for, this is a home, so if you feel like a family, feel like, of course,
but someone's like doesn't matter. But
you that is providing the first aid, you also have to be safe.
Oh yeah.
Do you understand? You also have to be safe. There are so many things that contain body fluids and all that. So you also have to protect yourself from those body fluids. People talk about putting a barrier.
Like a nylon?
No, definitely not a nylon. But because if you put a nylon, how then would the breath go?
It will go penetrate.
There are special barriers that people have. Some people also have their own masks in their pockets.
Oh.
So if, for instance, now I have my mask, I can
you have the mask. You go about with it.
Some people do. So I can place my own mask. So that means I'm very comfortable doing that. I can place my own mask above place it correctly, and then give the rescue breaths.
Okay.
And then watch to see if the patient is going to start breathing. But in all these, of course, you have to call for help.
Okay.
You have to call for help because you're not going to. There are so many. You're not going to do it alone. So you shout for help for other people to come while you're doing what you're doing.
Okay, so but I know I've seen instances, mostly for at accident scenes, you see that there's someone has passed out. While in a bid to help, they bring water, bring this, pour on the person, give them Sprite. They tell you they want to drink water. Is it applicable medically? Does it make any medical sense?
It doesn't.
Okay, so what is wrong with that? Is it harmful on the other hand?
You have to be sure what is actually going on. You understand? Because you're not going to give an unconscious person something to drink.
Okay.
How will it go down? And all that.
The whole bathing episode, the whole drum of water going on. So
you just end up drenching the person.
It doesn't. But anyways, sometimes Nollywood I think they're scared with that. To just put over that they're up already. Anyways, we would do the practical CPR thing. Just a moment, and once we are back, you see our CPR is done. And if you find yourself in a situation where you need to help, of course, our doctor in the studio here will let you know how you can do that. Stick around, we'll be back in a moment. Welcome back. And of course, if you just tune in, you're still watching Gyna Plus right on Afia TV. And we're talking about first aid treatment and what you should know, especially if you want to administer CPR. And if you're watching the show from beginning, Dr. Chinemelum here talked about why it's essential and what CPR really means. Now is a practical session to show how to actually do the CPR thing should you find yourself in an accident scene, or maybe you see someone who drowns in a pool or in a river, or maybe someone slumps within the house setting, the first action that you need to take to help revive them first before taking them to the hospital is CPR. And here's how it's done. Let's.
So, for instance, now, like I said, there's so many scenarios. It can happen anyway. It can be an accident. It can be drowning. It can be fire.
Or maybe the person has just passed out.
Or the person has just passed out. So the first thing is to make sure that you're safe.
Okay.
Make sure that the person you're going to save is safe too. So you move the person away from the harm to a very flat surface. So like now he's lying down. This is
flat surface now.
Yes, this is a flat surface. He's lying down on the ground, and then you check. Like I said, you have to know, is the patient breathing? Is there a pulse? Okay. So for breathing, you have to calm down. Sorry, my head gets in the way.
Okay, no, it's okay. As long as you can.
So you have to calm down and look at the chest.
Okay.
Rise and fall of the chest. That is what tells you.
It shows evidently that the person is breathing.
So for the pulse now, I talked about central pulses. So you locate the trachea and then move just slightly towards, it can be right or left, to the side of it. There's a groove between the trachea and the muscle. You feel for the pulse.
Once that is done.
Then once that is done. So if it's established that there's a pulse and the patient is breathing, you allow the person to recover. While, of course, like I said, you've called for help. While help comes, then, of course.
Okay, that way you don't need to do any CPR.
Yes, because there's a pulse and then there's the patient is breathing.
Okay, that makes sense.
So if, on the other hand, another scenario, the person has a pulse but is not breathing, that's where the rescue breath I talked about comes.
Okay.
So you try to give, for adults, you try to give like 10 breaths in a minute.
Oh.
Yes. So like that should be like 1 breath every 6 seconds.
Okay.
Good. So the third scenario, there's no pulse and there's no respiration. Now all these things you're checking have to be within 10 seconds.
Oh.
Because you need, time is of essence.
Of course.
So immediately the person passes out or has slumped, you're calling for help, you're running to the person, you're calling for help, you're checking, whatever you're checking, your respiration, the pulse should be done in less than 10 seconds. You've ascertained it, then you start your chest compressions.
Okay.
Now, how you do your chest compressions? You have to expose the patient, then get to the midline. That's I don't have to.
Okay,
so this is the chest.
Okay.
The center of the chest. That's the person. The center of the chest, below the nipple line.
Okay.
So you use the heel of your palm.
This is here.
That's the heel of your palms. You place it on the chest.
Okay.
Put the other hand, on top of the other. You interlock your fingers.
Okay.
So that way,
pressure.
Yes. So your elbow too should be straight.
Okay.
So you should lock it in. So everything should stay locked.
Okay.
And then your shoulder should be above your hand.
Okay.
So it's like your whole weight.
Oh, it's on that arm.
Is on that arm. So you pushing hard and fast. It's actually tiring. So you need someone to change it. So with the chest compressions, you're aiming to get 100 to 120 compressions per minute.
That's a lot.
So you're doing it. What helps you too is that as you're doing it, you're counting. I can't push it.
It's an emergency. Just imagine. Okay.
No, of course, it's an emergency. You have to do it. That's why you need to be trained. You need to be trained, and you still need retraining.
Okay.
Even for us that we've got the training, you still do a retraining. Keep yourself abreast. You do what do you call it? Some people, like someone said in the hospital, every week they create scenarios
on how
to, so that it's at your fingertips.
Okay. So as we wrap up now, because we will continue this conversation because there's a lot more on first aid that we still need to handle. So once this, let's say the patient or the person in a situation like this is, once you revive them, should you rush them to the hospital at that point in time?
Definitely, you have to rush the patient to the hospital.
And that way they get
but there's something I miss. So when you're doing the chest compressions, like I said, you're aiming for 100 to 120 chest compressions per minute. So you do 30:2 for an adult. So you do 30
For each.
And then you go and give your breaths, 2 breaths. And then you come back.
The same thing for a child?
The same thing for a child, yes.
Okay.
However, note that children come in sizes.
The chubby ones.
No, not even the. What I mean is that I mean age-wise.
Okay.
Different ages, different sizes. So you have very small children, you have the infants, you have the toddlers.
Okay.
So of course, for very small children, I want to, like the infants and the babies, what you will call the babies. I'm trying hard not to use the medical terms to make it as relatable as possible. If you do this hand,
you just kill them.
No, you cover the whole because they are small. So for those tender ones, 6 months or less, you can use 2 fingers
to compress.
Yes.
Oh.
Just the same position.
Under the nipple.
Under the nipple, and the center.
Okay.
Then you press the same 30:2. That's 30 compressions.
2 mouth to mouth.
2 breaths.
Okay.
It must not be mouth.
That's why I need to be very specific. All right. We need to we'll continue this conversation in our second episode, but basically we needed to establish how this is done, and I'm glad that we achieved that. Thank you so much, Dr. Chinemelum, and of course Chidera. Thank you for working out with this for us. So this is Gyna Plus, and of course we've been talking about first aid treatment, and this is what we call the curtains. Draw the curtains rather for part 1, and watch out for the part 2 because we'll bring you more information. My name is Doris Mayem Shishe. See you next week. Thank you once again for joining me on this very informative edition of Gyna Plus right on Afia TV. This is where we discuss health issues that affect women, girls, and children in the society. And last week we started something really interesting, and that was first aid treatment. And we talked about quite a number of things. And of course, I promised that we're going to be back with a continuation. Not like we left anyways. Time just had a way of cutting us off. And my name is Doris Mayem Shishe, and this is a continuation of the first aid treatment discussion we had last week on the show. And like I mentioned on the show last week, this is a special edition that is very beneficial for every single person watching me right now. So if you missed out on the part 1, I would like to advise that you go to our YouTube channel, Afia Culture and Lifestyle, that you can download and watch from beginning to the end. It's very interesting. And of course, still in the studio is Dr. Chinemelum Igbonekwu. She is a senior registrar, Department of Anesthesia, University of Nigeria Teaching Hospital. We didn't go, so I'm not going to say welcome back. Of course, welcome back. Oh, thank you for staying back. But we did a lot last week, Doc, and I'd like you to just do a brief rundown. We started with the first aid thing. I don't want you to go back to the meeting and all of that, but we dwelt more on CPR. There was a practical session of us doing CPR, and the part where we talked about how to help a choking person, specifically for children, and in the case of burn, what should be done. So take us through that choking part, a bit of burn, and then we get back to CPR. Just briefly, just a rundown, a recap.
So for choking, if for instance you're at home and the child chokes on his food, like I said, if the child can cough, we encourage the child to
cough.
Yes. Coughing will help to push out whatever is in the mouth. Good. Then you can also you give back blows to also help adults to choke. So if the person can cough, it helps to bring it out. Then you can give back blows. Of course, sorry, I still go back to the CPR. If the patient now becomes unresponsive, you now lay the patient flat and all that.
Okay.
So for burns, you run cool water over the burn area to limit the burn process. Then you cover with a clean cloth that is non-fluffy or a clean film, and then of course you take the patient to the hospital.
So this non-fluffy, is it like a cotton material?
No, what I mean by non-fluff is something that wouldn't leave a residue. Some cloths can yes. So let it be. It can be maybe a clean wrapper.
Okay, that wouldn't leave some particles on the wound.
Yes.
Okay. Now we also talked about CPR, and we had a practical session where you showed us how to do the chest compression thing. For this week, even while because of time, we couldn't finish the part where it should be done for children. We'll just quickly do that, and then we move on. Then let's, have that practical session. earlier last week when we were talking about CPR, you talked about how it can be done on adults and of course children. But because of time, we had to continue this week. I think you just wanted to show us further how the children thing works.
Okay. So we've talked about the ones for adults, male and female. So we demonstrated for children. So like I said last week, for children, you have the 2-finger technique, which is still at that point for the adults, the same point but this time around, use just 2 fingers and you try to compress the chest. Now you still compress to like 1/4 of their chest, anterior posterior diameter of the chest. Sorry.
That's a bit technical.
So try to compress hard.
Okay, deep,
deep. I think that's a more relatable. So try to compress deeply. So this is a big,
for a baby.
For a baby. Now I mean that the person we have before us is big. So for children, they are smaller.
Okay.
So you just use your 2 fingers. You compress
like this.
Like this.
Okay,
2,
like this.
Like this. So go in.
Okay.
1, 2, 3, 4, 30.
30.
Yes.
Okay.
30. Then you give 2 breaths.
Okay.
And then you continue. That's if it's only you.
Okay.
But sometimes it can be 2. But we're talking about what we're doing is like you're the only one available, right? So you do that 30.
30 how many times?
30 times. That's what I mean. That's what I mean by 30. So you count 1, 2, 3, 4,
times.
5, 6 till you get to 30. Then you go and give your breath.
So at what point should you stop?
And then come back.
Overall.
So, sorry, then I want to mention one more thing again. Now you can also do the thumb technique where you encircle the child. So your thumb is still at that point.
Okay.
But this other hand, these other fingers, are encircling.
Around the ribs.
The chest, yes, around the ribs. So
the chest region.
You also pressing.
Okay.
It's also another technique.
Okay.
You still do 30 compressions and then give rescue breath. So you continue that until help comes.
Okay.
Or until the there's return of spontaneous circulation. How do you know that? Until the patient starts breathing. Okay. Or until there's a pulse.
All right. That's basically it for CPR.
That's just the basics.
And that is like a very important part of reviving someone.
That is just the basics.
And it's as important as life itself.
It is very important.
All right.
Because as you're doing that, you're helping the heart, you're helping to pump blood to the vital organs.
Okay.
Do you understand?
First aid treatment. Thank you. Welcome back. And if you've been watching till this point, it means that, you're learning something really interesting. And we're still talking about giving first aid treatment, what you should do. So if you find yourself in a setting where someone passed out or slumped, of course, my guest in the studio has told us the practical things that should be done. So the idea of taking pictures, watching to post on the internet, or using water to bath the person who is in need or who is in danger, so to speak, is not the right thing to do, but rather check for pulse, do the chest compression, that's the CPR, or how did you call the other one, the breath thing?
I said you give rescue breath.
Rescue breath, and I learned that one on the show today. So that will come in handy if you have the information. So yes, I'd like you to talk about, we don't want to dwell on this as much, but there's a practice that is quite common, mostly among younger people. Someone is, maybe they call it convulsion at some point, where they're having seizures, and there's a spoon practice where they use a spoon to stuck in the mouth of the person so the teeth doesn't come together. First of all, medically, is this right? If it's not, what is the right thing?
Okay, so I'll say the right thing. I'm not going to say whether
it's wrong or not.
It's wrong or not. So you come in, you see someone who is having a seizure. So what do? The right thing to do is actually to move the person away from danger. And then
danger could be the wall where they roll and hit
just anything that you feel will harm the person.
Okay.
Move it away. And then lie the patient flat on the floor. Usually, it takes just a few seconds to stop. And then you now check if the person is breathing. So if the person is breathing, you allow the person. And then, of course, you check also for the pulse. If the pulse is also there, you just allow the person. So what happens in seizures is that there are different causes of seizures, but those the ones that we see commonly, the ones that happen maybe at home and all that, it takes quite just very in seconds is ended. So by the time you're even trying to open the mouth, put your spoon, get what and all that, those things are not necessary.
And they could be harmful.
It could be harmful, yes, it could be harmful. So just allow the person. I've actually seen one during in the church. So I don't know, maybe I wasn't concentrating, but I just saw that this child was falling off his chair, and then next thing started jerking. So I just helped him lie flat. So as I was doing that, the siblings now came and now said, it happens.
Oh, okay.
So it
That's
was like they knew,
yeah.
So just allowed them. Within seconds, they recovered.
But in scenarios like that, for someone who probably may never have experienced it and then it happens, you should also do the same technique and then take them to the hospital afterwards.
Yes, and then take them to, that's if you don't know the person. Yes, take them to the
Let's say in a public space
in a public space, yes.
And then you administer the first aid by lying them.
Just lie them
flat. Allow them.
It takes seconds.
Okay.
In seconds.
Okay. You see the way I'm looking at you,
because if for instance now, the right thing is actually to take the person to the hospital after recovery for evaluation.
Okay.
Now, of course, maybe if it happens in quick successions, like you have one in a few minutes, you have another one in a few minutes, of course the patient needs to go to the hospital. Of course.
Okay, I mean, let's move on. So now we'll be talking about first aid treatment. And I know for some families, some offices, like in my office, for instance, we have a first aid box. But for the benefit of those watching us, probably want to get one. What are those essential items that should be in a first aid kit? Okay. Basically, that you know would be of use if there's an emergency, health emergency. Okay, so that means you actually know something. No, I mean that's why I say for the benefit of those watching us. Okay, and want to acquire one. Okay, yes, I know there's one in my list. You go to the admin's office and you see a first aid there. I get paracetamol sometimes there too.
Okay, so you just need basic things for wound dressing. So any things for wound dressing. So you have clean gauzes for cleaning the wound. You have antiseptic solutions. You have you can have plasters for dressing, bandages, scissors to help cut whatever you need. Then of course you have simple medications like your paracetamol.
So I don't need to be a medical practitioner, of course, to have that as input. No,
you don't need to. Actually, every home should have.
Okay.
And every home that has children should have, because your children must need first aid at some point. You can't stop them from playing, you can't stop some activities, and then they injure themselves, and then you now have to administer the first aid. So it should have a place in the home, or it should have a place that is designated. Even your children should know where it is so that they can also get it.
All right. Thank you so much. We'll take a break, and once we come back, we'll, of course, plan to wrap up. And I'm hoping that you have learned as much as I am learning on the show. Stick around. Gyna Plus returns in a moment. Welcome back. I mean, it's so good to have you stay tuned. It's still Gyna Plus on Afia Television, a show where we discuss health-related issues that affect women, girls, and children. Specifically that. But today, because we care about you as well, I'm talking about the men, I mean, we had to do something very inclusive, which is first aid treatment and how it can come in handy for every single person who's watching right now. And we talked about quite a lot, including what should be in a first aid kit and then what you should do when you find yourself in an emergency situation. And now, beyond having a first aid box, I'd like you to give us safety tips on how families can stay prepared for emergencies. Individuals, families, it could be in a public transport, it could be in a public space, it could be at home. What are these practical safety tips to keep us, guided, first of all, even whether you have a first aid box or not? Okay, so the first thing in all this is just safety. Okay, what is it that
for example, now in the home, if there's anything that you know is going to cause harm to the children, because I'm saying children now because at the vulnerable age group. So if there's anything that you know that will cause harm to the children, it would be good to just remove it.
Those ones have a way of finding things for themselves. So you know what I'm looking at you.
Don't bring them in.
So you know what I'm looking at you because I have children too. Because that tells me the things they get out, you wonder how did they get to that point.
They got it because you brought them into the house. So if you hadn't brought them into the house, they wouldn't find them. So you have small beads.
Oh yeah. I see that a lot.
Good.
On the hair.
On the hair.
Somehow.
So either you don't bring them in, or if you must, maybe put them where their hands are not going to reach it. Then anything that will actually help,
like the kitchen area where they get you know sometimes when you're cooking, these children have a way of creeping into the kitchen, and that's why when I see children with burns like this, most of I don't get to blame mothers or parents too hard because I know how it can be. But is there a way one can navigate through that process, in a bid to stay cautious and safe?
Oh, well, the only way to do that is if you can what do I say now?
It's hard.
If you can keep them away from the kitchen,
away.
If you can keep them away from the kitchen, or if you, the mother, have to be more careful,
Shut them out,
those
more like lock them away and push them out.
Like the oil now, the hot water. If you bring them down, if you're done with the oil or if you're done with the water, you know that maybe either I still leave them if I still have space on the cooker, or on the sink, somewhere or outside, outside of the kitchen, outside. Do you understand? Or maybe in the bathroom, and then you close it. Now there's something. Now I talked about bathroom, I just realized, sometimes people leave water too, especially like in our state, unfortunately, when we don't really have water here. So the parents get water, they leave them in buckets without lids. Even if they have lids, they shouldn't be where the children should reach them because they can actually drown. Yes, they can actually drown. How big are these infants? You can have toddlers, infants that are crawling. So the bucket is this high, probably the same height as the child, so the child just goes in.
But that's extreme, because I wonder why they will have to go that far.
No, what I mean is when you store water, you actually keep them in your bathroom, or in the toilet, and you lock them.
Okay, that applies. Yeah.
You can put staples on your doors. You lock them so that they don't go to because you need the water.
You do need the water. Because I wonder why would that child go to that bathroom?
No, not in the bathroom. Actually, you should close it. So what I mean is, don't store water. Keep your environment as safe as you can. That's the first thing. So if your environment is safe, the casualties will be much reduced. Let's now be the unforeseen ones that you're now battling with. Do you understand? Maybe like fires. So keep your environment safe.
That's for children.
That's for children.
Then for adults, because sometimes adults too are victims of the whole oil burn thing. You see some moms on their leg.
Of course,
it spills somehow. That thing happened.
Yes.
So that one too, of course, you already established that no putting of egg, because nothing that would predispose that to infection should be done.
Don't put anything
so just
that will infect
cool it off. No salt, no
off.
rubbing of salt on the surface. I'm sure you can hear that.
And cover it.
Okay.
And go to the hospital.
Okay. Now, we're actually going now. More like while you're giving us that last tip, it was more like you are giving us a health advice. So safety is a watchword for today. Stay safe, watch out for your environment, and of course, keep things away from the reach of children. That's always a disclaimer on drugs.
On drugs, keep out of the reach of children.
So thank you so much, Doctor, for making our time to be here. It's been such an eye-opening session. For me, the CPR thing it's something that I won't forget. It's in my head, especially the finger thing and the what did you call that one for the children where you have to put your hand around?
The thumb technique, where you encircle the child, like you're carrying the child.
And then you use your thumb.
Then you use your thumb.
That stood out for me. It stood out for me. Thank you so much. It's been Dr. Chinemelum Igbonekwu. She is a senior registrar, Department of Anesthesia, University of Nigeria Teaching Hospital, and she's been, this week, talking about first aid treatment and why it's very crucial. So you can go to our YouTube channel, Afia Culture and Lifestyle. So if you missed out on any of these, take out time, watch and share the clip with your loved ones, because you could save lives on this, Thank you once again. My name is Doris Mayim Shishan. Keep watching Afia TV. We have more coming up, of course, on the show and beyond other shows. Thank you so much.